Good morning, everybody. And I'm lucky many people are already there in spite of the yesterday festivities. And thank you very much for this kind introduction. And I thank the Baltic Committee for giving me the opportunity to present some of my ideas and theses. My topic today is strong interlink between the malfunctions of the Stomatognathic System and dysfunctions of the Postural Muscular System and the Dura Mater and its pathological consequences. And I was surprised that almost every speaker, at least at the first day of this Congress, has emphasized the predominant role of the TMJ in achieving balance and harmony. In fact, it is not only the TMJ, but also the whole stomatognathic system, which consists of teeth, periodontium, jaw muscles, and cranial bones, and the trigeminal nerve with its special qualities. And I want to quote George Goodhart. He said, you can only keep what you give away, and that's why I built the Neurodontics Foundation. And after the theoretical part of my presentation, I want to practically and briefly demonstrate some ICAK procedures I developed for neurodontics. If you want to learn more about this organization, please go to our website neurodontics.com. I'm very grateful having had the opportunity to meet Dr. Goodhart personally in Velden in Austria at the Lake Werther during an ICAK meeting like this one. During that meeting, he shook everyone's hand, and I learned immediately he is a very exceptional person. And later on, I asked him for his new booklet, which has the topic You Will Be Better, the story of applied kinesiology. And he sent me a signed presentation copy of this booklet. And in this booklet, I found a very, very interesting chapter, which has the topic, the temporomandibular joint. And the second topic was why the TMJ, jaw joint, is the most important joint in the body and how it affects the rest of the body. This already is a statement. And let me share two other statements with you, and I quote. An example might be that there are 3,000 brain cells devoted to the temporomandibular joint, with 300 for the entire sciatic nerve lag situation. And the second one is, first the TMJ, and second its computerization effect. Many, many times you will find subluxations or alterations in structure which are compensatory, for example. Posterior ilium or posterior ischium is found, and if it is compensatory, problem normalization of TMJ will quickly restore the sacroiliac joint to normal by the normal body forces which usually operate to maintain the physiologic homeostasis of structure. In neurodontics, we understand Dr. Goodhart's statement that when you succeed, and if you succeed in normalization of the craniomandibular system properly, you will be able to solve postural lesions such as SOT category 1, 2, or 3 at the same time without manipulating the sacroiliac joint manually. And that is exactly what we found in neurodontics in most cases. I will give you a brief demonstration how to do that later on. I also want to direct your attention to one of the most important textbooks which are published by Dr. David Walther about ICAK. And the whole second volume is dedicated to the Stomatognathic System. This is already a statement. And And that's why it is, and I'm proud of owning a personally signed collector edition of this important work of Dr. Walter. And it is not surprising that, therefore, Dr. Ricketts, who was at that time the most well-known and most famous orthodontist, was asked to do the preface of this important book. And Dr. Ricketts appreciates Dr. Walter as a physician, and I quote, one who works with the ways of nature. Neurodontics recognizes Dr. Walter as the most authentical encyclopedist of AK, and especially for the unique role of the Stomatognathic System in AK. So this is Robert Ricketts. And the question of my presentation today is, why are neurological and postural influences derived from the Stomatognathic System more powerful compared to those from other parts of the body? And my first answer is the following. Embryologically, it is remarkable that the enamel, which is the outer layer of the teeth, has the same origin as the autonomic, sympathetic and parasympathetic nervous system. The same tissue which built the enamel, that is the ectodermal neural crest, this tissue also brings about the autonomic, parasympathetic and sympathetic ganglia, and also the IML, which is the intermedial lateral sympathetic cell column in the spinal cord. This evolutionary fact gives you an important evidence how strong the relationship between the teeth and the autonomic nervous system really is. My next point is the TMJ and the innovation of the TMJ itself. But first I want to make this point. Enamel building tissue has the same embryological origin as the autonomic nervous system. So the next point is the TMJ itself. And it is innervated by a branch of the trigeminal nerve, which is called the auriculotemporalis nerve, which you can see here. And this nerve comes from the posterior side into the TMJ and provides sensory and proprioceptive nerve supply. The same nerve, which is interesting, also supplies sensory innervation for the tympanic membrane and the external acoustical pore. And the anterior part of the innervation of the TMJ is done by the mesentericus nerve, which you can see here. And the fact that the mesentericus nerve is innervating the anterior part of the TMJ gives you a reason why the masseter muscle is often involved when TMJ dysfunction occurs. And there is the auriculotemporalis nerve. So, and as Dr. Gothard already stated in his booklet, compared to other skeletal joints, the TMJ sends 10 times more efferent sensory inputs into the central nervous system. So, I want to introduce to you a rather complicated scientific work of Baker and Linas from '71. And they wanted to measure the speed of the mesencephalic transmission into the mesencephalic nuclei. And I want to explain this message as simple as possible. They measured the speed by microelectrodes, and they found a 10 times faster transmission in 10% of the investigated mesencephalic trigeminal neurons. And they tried to explain this 10 times faster transmission compared to other proprioceptive neurons by electrotronic coupling. To explain this phenomena simple, the result of cooperation of several neurons can result in a 10 times faster transmission speed. And here you have a list of these unique features of the trigeminal mesencephalic nuclei. Together with the location of the first neuron in the mesencephalic nuclei, so there is no switch to a second nuclei, which is normally the case in proprioception and skeletal proprioception. So this makes also an advantage in speed. So the transmission speed is then 0.18 milliseconds compared to 1 to 2 milliseconds for synaptic transmission. So this leads me to the conclusion that at least from the TMJ, there is a strong and a super fast proprioceptive information transmission. And this makes the speed 10 times faster, and in addition to the 10 times higher quantity of neurons compared to other skeletal joints. And this may explain almost 100 times stronger effectiveness of the TMJ, and that is exactly also what we realize in our TMJ treatments in neurodontics. I want to mention to you the medial pterygoid nerve, which innervates the tensor veli palatini, who is responsible for ventilation of the Eustachian tube, and important for the function of the middle ear. And the second, and together with the other, there's a second muscle, I should show you now, which is the tensor tympani muscle, which also is innervated by the medial pterygoid nerve, which is a branch of the trigeminal nerve. So this nerve gives tension to the tympanic membrane. So what you learn from this is that the function of the middle ear is severely influenced by the trigeminal nerve. So here you can see the tensor veli palatini muscle. So in the case of asymmetric proprioceptive trigeminal input, you have severely influences to these both muscles, tensor veli palatini and tensor tympani, and in spastic tendency, possible dysfunction can lead to a filled ear sensation or tinnitus. So the point is, and concluding from all this, that the trigeminal nerve regulates the tympanic membrane tonus and the Eustachian tube ventilation by direct motor input. Let's have a look to the mesencephalic cortex itself. Here you can see a cross-section of it. And as you can see here, there is the mesencephalic trigeminal nuclei. And in this super fast way I mentioned before, these nuclei influences all the neighbors. And which are the neighbors? There is the periaqueductal gray, which is the mesencephalic pain control, as you can see here, right in the middle. And this is responsible for pain control and the opiatic reward system. And if it is dysfunctional influenced by the TMJ, maybe fibromyalgia occurs. And the second I want to talk to you is or to introduce to you is the ascending reticular activating system, ARAS called, which is here, and this is the circadian sleep rhythm regulation, and maybe in dysfunction responsible for sleeping disorders. And then there are the superior colliculi. As you know, they are responsible also for balance, which is here. And in dysfunction may lead to the sensation of vertigo. And the next one is the substantia nigra, which is the dopaminergic or motor system and responsible for starting and stopping movements. And they may be in dysfunction responsible for the development of Parkinson, Tourette, and tics. And the next one are the red nuclei, which are here, and they are this nuclei are responsible for muscle tonus, regulating system, and maybe in dysfunction. Postural imbalances may occur by trigeminal input. And the last one on this level of the cortex is the locus ceruleus, as you've seen here, is the noradrenergic stress handling system, and in dysfunction may play a role in the development of symptoms of burnout syndrome. So these are all mesencephalic influences. And here you have a list of all these influences. And descending, they are also in this same superfast way, which influences which are seen here. This is very, very complicated, and I want to do it as simple as possible. The first three are motor inputs into the cerebellum and in the trigeminal the cortex itself, the trigeminal nuclei itself. And the other one are influences to the facial nerve, vagus nerve, hypoglossal nerve. And as you already know, they are responsible for salivation, swallowing, taste, nociception, cardiovascular control, emesis. And of course, as I have already mentioned, the cervical cord and segments have the same predominant influence from the trigeminal nuclei, super fast influence. So if the stomatognathic system goes in dysfunction, or an asymmetric trigeminal input occurs, and maybe it influences the RS system to dysfunction, and possible sleep discomfort may occur. And the same influence reaches the vestibular nuclei, and may possibly dizziness occurs, and the same may reach the nucleus ruber, and postural imbalances occur. Therefore, we come to the conclusion that there is a direct neurological trigeminal input without relay to important cranial nuclei, which strongly affects skeletal and postural muscle control, sleep, salivation, taste, swallowing, emesis, cardiovascular control, pain control, and more. As Hans Garten already stated, the cervical spine and the craniomandibular system forms a unified organ. You cannot separate these neurologically. And because that's why sensory afferent nerve impulses from the craniomandibular system, the Dura Mater, the cervical, the shoulder, and the neck muscles converge to the same trigeminal nuclei. If you add the lover-brother relationship, which demonstrates clearly that this influence with the cervicals extends at least to the lumbar region. And as Dr. Seng Li correctly stated in his presentation, the balance of the craniomandibular system affects strongly the whole system. So the answer to my question is there is a functional unity between the craniomandibular system, the cervical system, and the lumbar system and the sacrum. And this is also exactly what we found in clinically. So, what is a kiss? This may be a kiss.
If you knew how much I loved you, how much I still love you.
This is a real kiss. So, but in orthopedics, it is often falsely presumed, at least in Germany, that suboccipital strain is the main cause of kinematic imbalances. However, the main causes really are the dysfunctions of the craniomandibular system in many cases. So maybe KISS can be craniomandibular induced symmetry strain. And only when teeth are not yet present, it may be also, and maybe predominantly, a kinematic imbalances due to suboccipital strain. So next I want to introduce to you a scientific work from Yoshinori Kobayashi and Tora Hansen from '88. And what these researchers wanted to investigate was what is the influence of occlusion to the hormonal production and regulation. They inserted a 0.1 millimeter occlusal build-up to the 6-year molars in the lower arch. And after 7 days, they measured the concentration of adrenaline and hydrocorticosteroids in urine and serum. And it was quite surprising that they found a 100% increase in concentration. And in addition to that, they found less REM episodes during sleep, more apnoe, more bruxism, and TMD dysfunction. So you may forget everything from what I have already said in this presentation, but you should at least keep in mind the following. The upper inside the contact, incentric occlusion of incisors, I mean 2 to 2, is the most neurological harmful stomatognathic dysfunction. So when maybe you try this, swallow and look for what happens with the teeth, with your teeth. Are your frontal teeth in contact? Swallow. So if this is the case, you have that problem. And you should fix it. There is another publication called The Effects of Periodontal Stimulation to the Ventromedial Nuclei of Hypothalamus Neurons in Anesthetized Rats. These researchers investigated the effects on the ventromedial hypothalamus neuron and hormonal production in hypothalamus by constant force loading on these incisors, which is not normal. If you load the incisors, that's not normal. And they found significant change in neuron activities and hormonal production, and these changes persist several days even after unloading these incisors. And you can imagine the consequently change of pituitary gland dysfunction when this happens. So, therefore, asymmetric trigeminal input, which may come from these contact points, may lead to dysfunction in hypothalamic dysfunction and pituitary gland dysfunction. And as you already know, these both are responsible for the function of the thyroid and sex organs and more. This example from Mother Nature demonstrates quite clearly that proprioception in the incisors must be highly sensitive. And hard contact creates immediate counter-reactions. If these counter-reactions while swallowing are not possible, dysfunction occurs. Therefore, occlusal habitual contact on incisors have an extreme negative impact on to the nervous system. So, consequently, we can summarize that there is a strong trigeminal impact on hypothalamic function and the pituitary gland, which affects hormonal production and regulation. And the second is there is scientific evidence that occlusal and incisor dysfunctions may lead to hypothalamic and pituitary hormonal dysfunction. So the body tried to prevent damage from sensitive parts of the central nervous system by providing duplications of Dura Mater for these parts. And as you already know, this is provided for the cerebrum and the cerebellum. But please keep in mind that there are two other important separate duplications. One is for the pituitary gland and the other is for the trigeminal ganglia. And this happens right in the middle of the skull and take also advantage of this maximum of protection. As you can see here, here are these both structures quite close together. And these are surrounded, for the trigeminal ganglia, it has this protection by a duplication of Dura Mater. Yeah. And in addition to that fact, it is known that part of the sensory innervation of the Dura Mater itself is done also by the trigeminal nerve, which indicates the strong relationship between the function of the Dura Mater and the trigeminal nerve. So, in conclusion, there is a maximum protection of for the trigeminal ganglia gastrica due to its location in the center of the skull and due to a separate duplication of the Dura Mater. So my next point is the distribution of the trigeminal impact from the mesencephalon through pons and through brainstem and until almost the end of the spinal cord, which is unique. And this is scientifically proven that that there are trigeminal extension into the substantia gelatinosa of the spinal cord. So, therefore, I would like to emphasize to you the significance of the unique expansion of the trigeminal nerve into the spinal cord compared to other cranial nerves. It is not an exaggeration to say that the trigeminal nerve is present in literally all parts of the nervous system. So let's come to the dental work. Let's say tooth extraction. Tooth extractions are normally asymmetric, and you can imagine how this works with this relationship to the whole body. This leads to posture distortion, this leads to SOT category 2 and 3, and it forms a smaller arch, and this leads to cranial compression, and it will for sure lead to asymmetric trigeminal input and hemisphericity. It will lead to lack of sufficient symmetric afferent trigeminal input into all these centers. So, but it can also lead to dental focus. The extraction site can have the quality of dental focus, and the neighbors can develop as a neurological teeth. So, and when it comes to orthodontics, crowding is often solved in normal cases, in normal orthodontics, by extracting healthy teeth. And I want to show you how we are dealing with this problem. So you appreciate that, and so do I. And as you can see, there is no overexpansion in this arch. So the point is, severe changes in craniosacral rhythm and the development of compression occurs by malfunctions in the stomatognathic system. So I want to show some impressions of our practice in Hanover, Germany, and every one of you is invited to visit us. You all are welcome. And of course, examination of all patients are done with AK. AK works for us as GPS in navigation. And let me quote David Walther. He said, AK can be a unifying factor in finding the best method of treatment among the vast amount of treatments available today. And I want to end my theoretical part of this presentation with the quote of Anton Chekhov. Knowledge is of no value until you put it into practice. So with neurodontics, you can make a difference. So if you want to learn more about neurodontics, please join me at my annual course in Vienna. And the next will be at the end of March in 2017. And if you want to learn more about this course, go to the website neurodontics.com. So, together with Simone Mack, maybe she is here. There, please stand up. She will cover the standard AK part in this course. And please feel free to approach us if you have any questions.